You're listening to The Physician's Mind, raw stories and real talks from people striving for greatness in medicine and in life. This is where ambition meets action and where the relentless come to level up. I'm your host, Curtis Wilkerson. Thank you so much for listening. Let's get right into it. All right, everybody, welcome back to the Physician's Mind podcast. I'm your host, Curtis Wilkerson, and today I'm honored to be interviewing Dr. Buck Parker. Dr. Parker, how are you today, sir?
How are you, man? Thanks for having me.
Of course, I'm fantastic. Let's dive right into this first question.
Sure.
Dr. Parker, you've had an extensive surgical background that includes trauma and acute care surgery. What was the most challenging aspect of your surgical training, and how did you stay mentally and physically resilient throughout?
Just the length of everything. I think is really difficult. It's hard. It's long hours, but sustained over that period of time. Like for me, it was like 6 years. You already went to undergrad. You already went to med school, and now you have, you show up your first year, and you're like, holy shit, this is extra fucking hard. And now I have like, you're 2 weeks in, you're like, oh, I have 5 more years of this. Like, whoa, dude. So, but I think that, you really have to have your why. And I've talked about this before in like different forums, but if you are not really sure why you're doing that, or you don't have a really, really strong reason, and the other thing is like the reason is if it's for yourself, it's probably not going to work because you'd be like, I don't need a house, I'll just sleep on the in the streets. But if you have a why for like other people or a purpose, a larger purpose, I think that's what keeps you going and sustaining through all those really tough times. So I think that would get the root of it.
Awesome, Dr. Parker. So you started your medical journey at St. Matthew's University in Belize, correct?
Yeah, yeah.
So that is a Caribbean medical school. What sort of unique challenges did attending a school outside of the U.S. present for you? Did it shape your approach to medicine in any particular way?
Yeah, I think everybody should spend some time outside the United States, especially in a developing country, and get that perspective. I think that was awesome. I really came back with, cars are not so important, fancy things are not so important. Like, holy cow, these people live with, not nothing, but they live a different lifestyle. And I think that gives you a good perspective to make sure that, you're not being a jerk.
Yeah.
You're like, wow, I won the pre-birth lottery being just born in the United States and all the things that we are accustomed to. And so that's a good reminder of, we're super lucky and to take it seriously and, do a great job for other people. And I guess that sort of helps a little bit with your drive as well, hanging in there and stuff. But yeah, it's certainly challenging when you go outside the States. You're labeled as a Caribbean student, you're too stupid to get into US school, obviously. And so you have this big stigma. It certainly is way more difficult to do that, to get into, especially a surgical residency, and you're limited on sort of where you can go. At the time, it was sort of all about the USMLE in step one and what score you got on step one. And if you had a really high score on step one, then you would have a lot more options from a Caribbean school, at least. And there was, again, at the time, there was specific schools that would take Caribbean students if they got really high scores. And those kind of schools were known, not schools, residencies were known. And so you had options, but there's certainly limited options. Now, after that, I feel like most of the people that I worked with, like as in other residents and attendings and things like that, took you at face value. Like if you did a great job that year, you kind of like, you got in there and you were a worker and you really, studied and all that stuff. Like they appreciate that a lot. And I think that that's one way you can um, sort of differentiate yourself from, the stigma, and you come in with this sort of target on your back, and once you demonstrate that you should be there, you're a hard worker, and you're you don't have to be that smart actually in surgery. You just have to work hard and apply yourself. And it's very hard. Once you do that, people really appreciate that. And I think they start taking you at face value and that stuff sort of goes away.
So would you say that for the most part, no matter where you are, if you demonstrate a strong work ethic and a commitment to overcoming challenges, ultimately you can achieve your goals?
Yeah, I mean, for sure. It's definitely everybody has, their own challenges. Everybody starts at a different place and sometimes your goals change and things like that. But that's certainly I think criteria for achieving your goals. You just have to work hard. There's some luck involved, I think, for everybody on some level, but sort of the prerequisite to doing that is just kicking ass on a massive level.
Absolutely. Every
Yeah.
day. So fast forward to your surgical career. In the high stress world of trauma surgery, Dr. Parker, how did you develop the mental tools necessary to keep an even keel and make quick decisions under pressure? Were there any specific moments where this skill was critical?
I mean, certainly there's lots of moments in trauma and emergency surgery that you need that skill. But I think that really you just learn it over time. I don't think there's any, maybe some people sort of have that innately where they're not super overwhelmed easily and, they can take on lots of tasks and, sort of remember that you're not the one dying and, it's somebody else. And even though that sounds sort of bad, but that's what the people that, I was modeling myself after did. And so you learn from them. And it's sort of just like surgery or just like medicine, it's a little bit at a time. And you don't jump in and you're like, oh, I'm just, I'm a superhero now and I can take all this stuff. It's a little bit at a time over a long period of time. And then you get better and better and understand everything. With repetition, things get easy. And so when you're talking about trauma, it's like a lot of people will say, "Oh my God, how did you do this?" You're like, "Well, I've done like 80 of these."
Yeah.
After a while, everything becomes routine. Now, of course, in trauma, you always get something you have never seen before. And you're like, holy shit, what is this? How do I deal with this? So there's always going to be those times. And even, 10 years in, you still get that stuff. And you're like, call a friend, phone a friend, like, oh, what's going on? Sometimes you can't do that because you're in the OR. But even then, really, you should be, gathering other people and saying, hey, are we doing this right? Um, let's think about this in a different way or call a colleague that you respect and so you're always kind of doing that. Yes, there are times where that's not possible and you're shitting your pants, like, period. I had a 5-year-old that came in with epiglottitis and they couldn't intubate him. And anesthesiologist said, "Yeah, I think he needs a crike." And I was like, "Dude, a 5-year-old, man." I'm not a pediatric surgeon. This was not a pediatric hospital, but of course they came into the ER with epiglottitis. Of course, he's there, so now it's not like you're going to send him somewhere else when he's losing his airway. So I said, "Well, let's go to the OR, and you can try to do it under controlled, sort of." Uh, situation, environment, and stuff. And we'll go to the OR, and you can try, intubate him a couple more times because the kid was still oxygenating okay, and but the anesthesiologist was like, I don't think I can get it. I took a couple looks. I don't think I could do it if I try to put the tube down there. I think it's going to swell up more, and I'm going to have a tough time. So I'll lose the airway. So we said, okay, let's go to the OR. We prepped him out, everything, got the kid out, on the table. And I'm thinking to myself, like, I've never done a 5-year-old, but I've done lots of crikes, right? Emergency and things like that. Then tons of trachs. So again, you did it. I've done it. I've done over 100 trachs probably because we did a lot of them in the ICU under control measures. I've done a handful to 10 probably emergency crikes before on adults of varying sizes. And so it's just another kind of variation of the same thing that you've done. But I'm still shitting my pants. I'm like, oh my God, this kid to die on me. And so, yeah, anesthesiologist wasn't able to get the tube. And so I did it and it turned out okay. The kid lived but that's just what happens. And sometimes that's that's trauma. That's emergency surgery. So, but I like we stand on the shoulders of those that come before us, really, because I had watched these people in a lot of different scenarios and have them stay calm. So, I thought, well, I need to stay calm for everybody else in the room, because they stay calm for us before. I'm like, okay, now it's my turn. I gotta stay calm for everybody else in the room, because you see the nurses and everybody like kind of like, oh my God, this kid's gonna die. Yeah, you learn from other people over time.
And could you give us the elevator pitch of what that operation involves?
I mean, yeah, it's it's actually kind of short, right? Because you just like for him, Crikes, you're supposed to do a vertical incision, but I like to do a transverse incision just because I've done so many of those. And the reason you do vertical is because you have these two veins that run here, and so if you hit those veins, then you got blood all over everything, and you can't see, and you don't know where things are. But that's sort of for like military layman, somebody that doesn't do that a lot, like ER, right? But we do them so much that I know where those veins are. I can make the incision, go around the veins, not to hit the veins. So I just make it's a nicer when they're done with everything, it looks nicer like this than like this. And so I did a horizontal, and then mm, yeah, just a couple hemostats. The kid's so tiny and there's not very much tissue there. So it's just a couple spreads of the subcutaneous tissue. You just for kids, it's really a trach. So just a little bit below, like one finger breadth below the cricothyroid, and make a horizontal incision, put the tube in, and hope it doesn't slip and all that stuff. It's very easy to see when you have the kids, which I had never done before, but it was kind of a lot easier than a lot of the other crikes or trachs that I have done, because the kids just don't have any fatty tissue in there. It's just you know almost almost nothing. And so it was a lot easier than I thought it was. I've done some really tough ones, so that was all right.
So, transitioning to the topic of entrepreneurship and your online presence, Dr. Parker, you have successfully developed a large scale personal brand online. So, I'd love to pick your brain about that. But let's go
Sure.
back to when you were a resident. While in residency, you began an e commerce business, which ended up growing into a $1 million venture. What was the catalyst for combining your surgical career with entrepreneurship, and how did you balance the two?
Yeah, it was just bad decisions. I mean, but I was always interested in sort of starting my own business. My parents had their own business. They owned just a motel and restaurant, and they kind of ran their own business. And I had been part of that for a really long time, and always thought, to myself, oh, that'd be kind of cool to have a business on the side. Well, you don't know what you're getting into in surgery and things like that. And then the old internet comes around, and sort of social media. Well, social media wasn't around really. I mean, I think it was just starting, but um sort of Google search was getting a lot bigger, and I learned about sort of like AdWords and how the search engines worked, and I was like kind of fascinated. I was like, "Whoa, this is kind of cool. If I do these things, then I can be first on Google and for, my keywords and stuff like that." And so I found um I found a course like that time. It was like DVDs. You buy these DVDs, you watch them, and it teaches you sort of different levels of e-commerce. And I was like, oh yeah, I can do this, no problem. And then, halfway into it, I was like, oh my God, I'm an idiot. But anyway, I hired somebody to do the website and sort of put the store together, which I didn't know how to do. And then I just wrote my own articles and posted them everywhere. And I did SEO for this website, and just was an affiliate. And so I sold these. I don't know if you remember P90X and things like that. There was some just uh, DVD exercise DVDs, and so I sold a bunch of those and did that same thing. So I got on the first page of Google, and I was like second or something, and that company was advertising so much on infomercials, but this was the crossover time between when people were okay, starting to be okay buying things online. And so they would see an infomercial and say, well, I don't want to call someone because I get this big pitch. Let me just go online and see if I can buy it online. And so they would go, they they saw this advertising, then they would go online and they would buy it. And I was second. And so if they didn't like the first website, they would just go to mine and then buy it. And so yeah, ended up doing that really well. And of course, those things always are moving targets because SEO changes, the company changes, the products change, and all that stuff. And so it's like a constant thing. And I thought, oh, if I just throw this out here and get that thing on Google, and I'll just coast, and that's just not what happens. It's like a lot of work, forever. So that's like, well, this is great for the time being. And then after a while, I said, yeah, it would, it's a great career. Like you can spend all your time doing it and make a ton of money. But I was like, well, this is not what I want to do. So very important. I think it's very important to understand that whatever you do is probably going to take all of your time. So you want to make sure that it's something that you want to be doing and that you want to fill your life up with,
Good advice.
e-commerce and SEO and writing and figuring out the algorithms was not something I wanted to spend all my time with. So.
No, and similar to what you said, I'm feeling like an idiot right now as I try to develop my website and build my brand for the physician's mind. I'm opening up the website platform. I'm like, I have no idea how to do
Yeah,
any of
it's
this.
a lot of work. Yeah,
But
it's fun though. But I think it was a great learning experience, and it's outside. I like that when people do things outside of medicine that are not just physicians, because when you talk to those people that are just physicians, it's kind of like there's no depth there. Like they're great. I'm not saying there's anything wrong with them. I'm just saying, like, when you have a conversation with them, you're not going anywhere but medicine.
yeah,
You go to dinner with them, you're just like all fucking medicine. You're like, dude, can we not talk about medicine for like 2 minutes? But it's all right.
no, I mean, that makes sense. So let's talk about your Bitcoin mining as well, another unconventional move for a surgeon. How did that venture influence your perspective on perhaps financial freedom within the healthcare system?
Yeah, that was just a sort of some luck or whatever. I went on a trip and I met this guy who was mining Bitcoin. I had actually tried to mine Bitcoin in 2011. I didn't even know what I was doing. It was an electronic coin, and that I found, on whatever, just doing research. And I'm like, hey, I want an electronic coin. So I got this software and put it on my Mac, and 5 days later, I didn't even have like, point 0.3 or point 0.5 of coin. I was like, well, this is stupid. Like, I just want one coin. How can I just get one coin? Anyway, I just totally forgot about it. And that probably half a Bitcoin's floating out of there somewhere on a Mac desktop. But so yeah, so I met this guy. He was mining Bitcoin and doing it kind of like not individually. He was hiring companies to take care of his servers and things, and sort of pointing me in the right direction. I did my own research, and he connected me with a couple people that could take care of him and things like that. So I got some options. Sort of looked at it for about a year or so, maybe more, and then ended up buying like probably like $250,000 of Bitcoin mining machines. And then that was pretty lucky, honestly. I just bought them right before a big surge in the price. Didn't know anything about the, the price fluctuations, cycle, the crypto cycles or Bitcoin cycles or everything like that. And just got super lucky. And then once I did make some money and made a bunch of Bitcoin and started learning about it more, blockchain and the cycles and things like that, realized that I had really not looked at finance stuff, or investments very much. I had K and all the normal stuff, but outside of that, I really didn't know that world. And then I was like, wait a second. I just like did a 22x on my money over here. And how come nobody's telling me about this stuff? Is there other things like this? Uh, the other thing is that when I met that guy, I got sort of introduced to a group of people that were not any smarter than me, having a great time, lots of not lots of free time. Yeah, they had lots of free time, but they're also working very hard and providing for their families and doing good things also. And so I was like, okay, well, maybe I can sort of dip my toe into this world and do a little bit of both. But yeah, I think that it just gave me the perspective of like physicians, we do great things, and it's a great path, but we get abused, right? I think by mostly, it's not anybody in particular. It's not like a certain administrator. It's not a CEO. It's just like sort of how the system is set up, and it's sort of how we have accepted our role. Where our role is, we're selfless. We give everything to the patient. You know, it doesn't matter that we're missing birthdays and weddings and anniversaries and things like that. And I think after a while, I was kind of a little bit bitter about that. I was like, I did all this work and I thought I was making pretty good money, but that guy's making 10x or 20x of me, and he's not doing any more work than I am. He's working hard, but um and he had a lot more free time, and it was kind of interesting. So I sort of that's why I sort of went down that path, and I like to just at least give that idea or exposure to other physicians so don't they're just not like in this thing that they feel that they're getting abused and don't have a way out. And I kind of sort of in the near future I'll probably be doing that, is getting exposure at least for physicians and allowing them to have choices instead of just saying, okay, well, this is the only thing I can do, because after a while you're sort of like locked in. And then if your boss or administrator or whatever wants you to do X and you're like, I don't really agree with that, um, you're gonna have to agree with that. Otherwise, if you don't have another option, if you don't understand that other world. So yeah, changed like a lot. It changed my life. Yeah, pretty much is doing that.
Well, I talk with guys all the time about financial freedom as it relates to work, insofar as once you have enough money to be able to live life on your own terms, you can then work because you enjoy it rather than because you have to, and you won't have to be as subservient to authority because you have enough autonomy to say no to those kind of things.
Yeah.
It just stresses the importance of having that financial literacy and knowing what to do outside of just
Yeah,
medicine.
and I think that, I'm not saying people don't have that in medicine, because I often would run into nurses or physicians that you could kind of tell that they have that because they have a little bit more relaxed demeanor. And yeah, you just sort of know that they are feeling better about it and they're there because they really want to be there and they enjoy it. And then when they're off and they have their own time and they're not worried about, coming back. It's tough. I think, different specialties probably look at this differently. It's too. I think surgeons sort of traditionally have been in in this way of thinking that, I have to be there for the patient no matter what. And fuck my family, fuck my kids. Like it's 2 o'clock in the morning and we got a vacation tomorrow, but my patient's leg went cold. I got to go in and we're skipping the vacation. Like, you know, uh, that may be a little bit old school now, but certainly that's how, I was sort of raised in surgery. And I think a lot of surgeons also feel that way. So I think that if, if you can be in a place, it's really tough for surgeons because, you know, oftentimes you're in a place that it's like, it's two guys or,
Mhm.
two surgeons or one surgeon, especially if you're a specialty, you're okay, you're a vascular surgeon. There's only one vascular surgeon covering 5 hospitals. You're like, I need some time off. Like, well, we don't have anybody else. This patient's leg's gonna go cold or he's gonna die. What are you gonna do? Or, whatever it is. And so you have this guilt, you're like, well, if I don't if I want to go on vacation, this patient dies. Like that's terrible.
Yeah.
That's a terrible position to be in. So it's just a really tough thing. So I was at the last place I was at, we had two surgeons, and it was like you're either on or you're on backup. And so you kind of we for a while I was just on. I'm just always home, always sort of on. I'm either on the 24 or I'm doing backup for the guy that's on 24. We eventually got a third surgeon, and so that allowed us to get um, take some time off and do those things. But it can be really difficult, and you don't want to feel like you're leaving these patients. So it's a really difficult problem sometimes.
Yeah, that's certainly a hard one to solve. But let's talk about your appearance on the island. Can you tell
Oh
us about
yeah.
your
Okay.
experience, Bear Grylls, all that action?
Yeah, sure. Yeah. Cool. It was a great experience. I think that every physician should go through a real starvation because you learn, what your body does, how it, we starve the shit out of patients all the time. Oh, your NPO again today. And they're like, what? I haven't eaten. So it's really good to experience that. That was 30 days. We were probably eating about 100 to 200 calories a day for 30 days. So not forever, but long enough to understand how starvation affects you and it affects your mind and your body and your muscles and things like that. And so, yeah, it was a great experience. The importance of water, the importance of, again, I think it was a revisit of my time in Belize in a way, because you're out there, you don't have anything, after a while you're like, I just want a chair. Like I just want something that doesn't hurt to sit on, because your bone, your muscles are sore, your bones are sore, like it's just so weird. But you come back, you have appreciation for everything again. So it was a great experience in that sense.
And for those who may not be familiar, can you give a brief
But
description
yeah,
of
it
what
was,
that show was?
yeah, Bear Grylls, he's a survival dude, and we had 14 guys on this island in Panama, and it was, no food, no water. Well, there was some water, but we had to find it there. And then we had to, filter it and boil it and all those things, and limited amount of food. We're in the ocean. You can catch fish, but we caught very few fish, and we're eating basically mussels and crabs that we could catch. And so it was basically like the premise was, can the modern man survive? And it was a bunch of like regular dudes who didn't really have too much survival experience out there. And there was no prize. We didn't have, we with Survivor, they have like the cameras in your face and the cameraman there. So we did all the camera work. And so there was nobody else with us.
Wow.
And so they tried to make it more of a raw or authentic feel to that. So we got this, I got the raw feeling. Yeah, it was real.
Were you there because you were a doctor or were you one of the random guys?
Yeah, so they cast people specifically. There was probably like 8, 6 or 8 of them that were just like sort of random dudes. And there was 3 guys that had been cameramen on other shows like A Life Below Zero. So we were
Okay.
cameramen on that. One was Deadliest Catch. He's been on Deadliest Catch. He was the cameraman for that. So they had a lot of like extreme camera experience. So there was one TV camera that they kind of handled, and then the rest of us had GoPros and things. And so and then I was cast to be like the, triage guy. Essentially, it was me and a paramedic. And so they asked us to like, hey, just if anybody has a problem, these here's the steps that we want you to take. There was like a little medical pack with, you know, Tylenol and Benadryl and things like that, not much. And then if anyone needed an actual IV, they had to be removed from the island. And so we had a radio that we could say, hey, we need medical help, and something's up. So ended up actually, I think, 4 sort of like medical emergent, not real medical emergencies, but just heat stroke. A couple guys got heat stroke pretty bad. They had to leave. One guy, we thought he injured his back pretty bad, but so he left. But it was interesting is that I think what I really learned out there is, your mind will try to get you out of bad situations in any fucking way possible.
Yeah.
And I think a couple of the guys left, and I thought that they had a real problem. One was like, I thought maybe he had a bowel injury or something because we were eating all these shells. He was a huge dude and he was just eating whatever he could possibly get. And he was just swallowing fucking crabs, like just the fucking shell and everything, right? And I'm like, and then he had this, he was his heart rate was up, his belly hurt, it was super tender and all this stuff. And I was like, dude, I think maybe you got a like a perf, or something. I don't know. And you're on an island, you can't do anything. You like, what do you want to do? And he's like, I want to get the fuck out of here. I was like, okay, fine. We sent him away and we sent him off. And then the next day he's like, good, he's totally fine. And
The hell?
then the guy who injured his back was very similar. So I think almost it's not conscious, it's like subconscious, and they thought they were injured. And so they're like wanting to leave. So that was very, very interesting to watch the dynamics of everybody and how they dealt with that. And, some people were at the beginning where they were, just crazy almost that they had to leave. And then others, sort of later where there were certain checkpoints during the time where we thought we were going to leave at 3 weeks. They didn't tell us. They said it could be 3 weeks to, you know, 4 months. We're like, okay. So like at 3 weeks, everyone's like, hey, today's the day. And then that didn't happen. Then a couple guys were like, I'm sick. And they left. They're like, fuck this, I'm out. So yeah, it was just awesome to sort of watch all that stuff, especially as a physician it's like see how the mind works. Yeah.
Damn, that's cool. And was that pretty much your first exposure to some national media?
Yeah, really, that sort of kicked off my social media because on that show, I started getting a lot of questions on Facebook of like, "Hey, I saw you on the show. Um, I want to ask you this question. I want to go into surgery. I live in the Philippines. I live in Nigeria. I was like, whoa, holy shit," because it went everywhere. And so then I just started answering those questions for those kids on YouTube, on Facebook, or whatever, and that's sort of what kicked everything off.
And to apply on it, did you like just apply online or did you get recruited?
Yeah, it was a friend of mine who was in TV, and she saw that they were looking for a physician on this survival show, and she's like, "Hey, you should try this." Like, I was like, oh, "Sure, I'll apply." Whatever. It was just email and a couple pictures, and then after that, it was like interviews and things like that. But
Oh, it goes to show the power of a strong network. I talk about that all the time, making
yeah,
valuable
for
connections.
sure.
So
Yeah,
a
I was
couple
not
more.
planning on going any shows at that time either. It was kind of really interesting. I've always been a person to say yes to crazy shit, and I think that's for me. Um, it's been fine, right? Like you do make fun, you make a fool of yourself, and for me that's okay. But I think a lot of people are like, oh, I don't want to look this way or that way. I was like, I'll try this, I'll try that, I'll try that, and some things are great. And so I did this dating show that was terrible. Um, I was actually trying to get on Survivor, and they said, "Well, you do this dating show, and we'll put you on Survivor." And I did the dating show, and then they fucking ghosted me. And I was like, "Oh
Right.
my god, I'm a fucking idiot." And but whatever, people are gonna probably not like you for other things anyway. So you just do whatever you want.
What was the dating show?
It was called The Proposal. It was basically the Speed Bachelor. It was like 10 girls and me and one
Whoa.
date. And it was just such a fucking terrible show. And then it was like right during the Me Too movement,
Oh
and
God.
everyone's like, "You are a piece of shit. You have 10 girls on here." I was like, I don't even care about this show. I just was doing it as a favor to get on this other show. So I look like a fucking moron, but whatever. It's fine.
Man,
Nobody
that
even knows it anymore. Look at that.
yeah, the
Thank God.
proposal. I wonder if they still have it on. I have no idea.
I think it only did like 1 or 2 seasons.
For your sake, hopefully they don't have it on anymore.
Yeah, exactly.
Okay, well that's awesome. Now there's a couple more questions I want to ask you about your business life and your business mentality. First and foremost, it's obvious that building a big personal brand comes with some unique challenges. Were there any hurdles that you faced in generating your YouTube channel and your social media presence, and how did you overcome those to get to where you are today?
Well, yeah, I mean, especially in medicine, we've seen that, you can't say everything you wanna say for sure. I mean, for people that don't know, I got fired in 2020 for discussing COVID and sort of like, um honestly, I thought it was what every physician should do, and it's what we do every day is we question everything. And, we say, is this the right diagnosis? Is this the right treatment? And then we have conferences about what we did and if it was correct and what we could do later that's better. And it was just a conversation about that. And sometimes I say things that are, controversial, but in a way that probably wasn't as nice as I could have said it, but it was still the same. I think a lot of people got the gist of it. But that was the first time I was sort of introduced to the extremes of how everybody thought and how we should be. And then the CEO who fired me, he didn't like my YouTube to begin with. And he would ask me to take things down and take a small clip from this, you know, 20-minute video and say, what, you said this, you got to take this video down. I'm like, did you watch the rest of the video? Because it's an amazing, message. This is like, my message is always trying to be positive for students and telling them how medicine is a great career and you can do a lot of great things and stay strong and all that stuff. And it just wasn't like that. And so he just, I think it was the last straw for him, whatever. Of course, they asked me to come back like 6 months later, but
Interesting.
I was like, no, no, thanks. So yeah, it's certainly really difficult, especially now. It's almost like, yeah, I don't envy anybody is doing it right now because you you sort of want to do it for your brand because you're going to be a physician. You want people to know who you are. You want patients to find you and all this stuff. But if you say anything wrong for the rest of time, someone's going to come back and say, you said this on X and we have it right here and you're an idiot. And so it's a lot of exposure. And I think that's what those administrators didn't want. They're like, we just want zero exposure. And I would go to them and say, let's do a teaching lab in your sim center for a chest tube or whatever. And they just say, no, I don't want anything. And it was really disappointing because there's so much opportunity to teach at that time. And I have a couple of videos that did, millions of views and that are teaching like the suture videos and things. And I was like, I just see this as a great way to teach kids, and also get people to know you, right? You're teaching it and it's fun. And that's one of the things that I did love about surgery residencies. You had all these interns and stuff. You got to teach them all this cool stuff because surgery's fucking rad. And you're like, check this out. Look what we can do. And they're like, holy shit. That sense you get from the new, intern or a med student is just awesome.
Yeah.
So I wanted to do that on social media too and YouTube, but man, it was really, really tough. And unfortunately, I don't know if I hit the wrong time or whatever, but hopefully, well, lots of people are doing that now. So, and they're doing it pretty successfully. So there's certainly ways around it, but I think it just hit sort of the wrong timing in that era, I suppose.
Yeah. And that,
And what do I do now? It's, it, it's just, it's a lot of work over time. Again, same thing with social media as with surgery. It's a lot of work over time. You just have to keep going. I think when I first started, I remember Gary V, who I don't love, but at the time I was listening to him a lot. He was just like, just commit to yourself. You're going to do 100 videos and nobody's going to watch them besides your mother. And maybe one of those videos or posts will catch fire and somebody will like what you're doing and understand you. And then you can start building from there. But until you do 100 or, you know, then you probably don't know what you're doing. It's not going to be very good, but nobody cares anyway, because nobody's watching you. And so that's kind of what I took that and said, okay, I'm going to do for a year. I'm going to do these YouTube videos answering these questions for these kids and see what happens. And then in that year, I, you know, Google liked what I was doing. YouTube was like what I was doing. And so they started promoting the videos and I started getting a lot of traction pretty quickly.
and what year was that you started?
So the show was 2015. That was probably late 2016 or 2017.
And what year did you graduate residency and begin work?
2010.
2010, then around 2016, 17. Is that starting from zero, the YouTube channel, everything just brand new?
2017 started, 16, 17, I started from zero. I actually did, I started posting videos on YouTube in 2011, my first year out, and I started to do educational videos about surgery. My first one was like appendicitis, appendectomy. I did some colonoscopy ones, maybe some gallbladder, and they're super old. And the original one is still on. It's so old. Um, but they didn't go anywhere. Hardly anybody was watching them, and so I did that for like 4 or 5 years, but it wasn't consistent, and it was very difficult to make those at that time. I had to lease um, like animations for the surgeries, and 2 years would go by, and they'd be like, "Pay us again for our animation." And we're like, "Oh my god,
Damn.
this is crazy." So yeah, it was super hard to do, and I had to have um, somebody help me edit. I didn't know how to edit all that stuff, so it was, costing me like $1,000 a video. And nobody was seeing them, so I do like one or two a year. I was like, oh, maybe did like 10 videos in 5 years, something like that.
Hmm. Well, I think it's a testament to, well, I mean, at least because I want to say it's a testament to consistency, but considering there was 2 videos per year.
Yeah, it wasn't very consistent. It was in my mind as consistent. Yeah. So
Well, what advice would you have for an aspiring entrepreneur, be it in medicine or outside? I guess initially, let's talk like a guy in medicine, med student, resident, doctor, whatever, who wants to embark in some sort of entrepreneurial endeavor. What advice do you have for them as they start out and enduring that period of stagnancy before they really?
yeah, I think, well, first of all, you want to make sure that you're not taking away from medicine too much. And the second thing is that you'll probably evolve. And if you don't if you don't ever start, then you'll never start. You'll never do anything, and it won't be any good. And it's probably going to be not very good for a while until perfect your craft, just like everything else, just like surgery. You got to get the reps in. You got to keep doing it, and you'll get better and better and better. And then at some point, you'll look back and be like, these are pretty good. But you will look back and say, these are awful. Like, I'm embarrassed. If you're not embarrassed of your stuff in the beginning, then you started way too late, or you never started, because I think everybody is. So I don't think you should be discouraged by that, but it does take a lot of time. It's a craft, just like everything else, and so you have to practice.
Yeah.
And I think maybe, honestly, looking back, I should have got partners, maybe, or people to help me, because I was doing a lot of stuff on my own. And I think that takes a lot more time than if you have somebody else that's good at something. Like I'm good at X, you're good at Y. Great, let's put it together, instead of like trying to learn everything yourself, and that'll just sort of speed up your process.
Yeah. Yeah, that's good to know. And your comment about being embarrassed about your initial content rings true with me because I think about my third episode being recorded in my buddy's attic in Kansas on Zoom with AirPods.
Yeah, that's fine.
So you come a long way from the beginning,
Yeah,
it's
good.
part of the deal. So as it relates to 2020, when you got fired for the COVID video, how did that experience affect your mindset and your career direction moving forward? What kind of changes did that prompt for you?
At the time, I was pretty burned out, and so when I got fired, I was very relieved not to go back to work, honestly. And I was yeah, I had this Bitcoin mining business that was doing well, and I just thought to myself, "Well, I'm gonna take a year off. I'm clearly burned out. I'll get back in there." And one thing led to another, and just started to get into different things in technology and blockchain and things, and just thought, "Man, this is a great life." And I think a lot of, this all depends on your situation, but in my situation, I felt like going back was too much negative vibes, I guess. And I was really happy where I was. And so I thought, well, let me pursue what I'm doing. And maybe at some point I can wrap medicine back into this somehow. So that's kind of where my mind is at still, even though it's been a while. But I do love medicine. I think, we do great things for people. It's a great feeling to help other people. That's why I went into it in the beginning. And so I sort of want to do that on a larger scale, and hopefully using technology to do that. in the near future. So yeah.
And are you still in clinical practice at any time since then, or is it full education,
Yeah,
entrepreneurial content now?
correct. Yep. No clinical
Gotcha.
practice.
So, in that experience of dealing with controversy and public opinion, how has that influenced the way you approach your work now? Because I consider, as I develop this podcast, I want to have a commitment to open minded discussion, a commitment to truth in the face of any scrutiny
Yeah.
outside. So, what are your thoughts on that?
I think, there's always going to be somebody or lots of people that disagree with you. And especially in medicine, medicine's very difficult. And I don't think people understand how difficult it is to find the truth in medicine. And I think that we're constantly like, you should not have been doing that for 20 years. And I after a while, I've been, uh, went to med school in 97 and and after that period of time, you realize that there's no truth. There's nothing's 100%. And so you are always finding, and in addition, you see things repeated, and it's like, medications that are supposed to cure everything. And then 10 years later, they're like, oh my God, we're really fucking people up with this. We're going to pull this off the market, or we're going to stop doing this, or whatever it is, or this type of procedure, was causing all these problems. And so it it it's really difficult now. It's sort of like when you have this public, people are searching Google and they think they know the truth, and they find an article that says X, and they're like, "You're an idiot because this article says this," and you're just like, "That fucking this one article over." Whatever. It's not even close. They don't understand like how deep it is. So I think that overall you just have to commit yourself to being, an independent thinker, and also not independent, but critical thinker. And as long as you are trying your best to be a critical thinker and trying not to be influenced by, I guess, public opinion, that you'll be able to sleep at night. I think that it's so hard because medicine has become politicized like I've never never would have imagined. When I was practicing, we'd have these conferences and everybody would discuss treatments and protocols and diagnoses or whatever. And I think you just have to try your best to be independent and critical thinker, and that's it. And I remember in med school just being like, I don't understand that, you know.
Yeah.
And if you can raise your hand and be like, I don't fucking understand this, or I don't think that's right, please explain to me how this is correct or whatever, then I don't think you can go wrong. But I think allowing other people to push you in certain ways is dangerous. And I think we saw that a lot of, obviously, with COVID, and a lot of people got silenced because they were scared to lose their job. Now, this all wraps back into financial freedom and doing all this other stuff. Um, and so it's so difficult because you want to do the best you can for your patients. But right now, with all the voices are out there, and you just get hammered if somebody doesn't like what you're saying. And it doesn't matter. You're always going to get hammered for whatever side, whatever opinion you take or stance you take. And so, man, it's just, yeah, you have to, it's difficult to navigate those waters because you have a job, you have your patients, you have yourself, and you're trying to manage all that stuff, stay true to yourself, do the right thing for your patients, keep your job. So it's a little bit of a balancing act. But I think at the end of the day, ask questions. If you don't understand something, dig deeper, try to be independent or a critical thinker. And also, I think that you should, yes, take advice or consider lots of different voices. But at the end of the day, I I think it's important to have people around you that you trust and that you look up to be able to at least bounce things off of and say, what do you think about this? And I'm thinking about it this way. What do you think? Because you'll come across people in your career that you're like, this fucking guy makes sense. This woman makes sense. Okay. All the things that they've done for the last 20 years has been fairly correct. And when they're not correct, they're like, I fucked up. My bad.
Yeah.
So when you find those people, stick to them or always have them around and sort of be able to discuss things with them and forget about everybody else. I mean, the public they don't know what they're talking about. They don't. In medicine, they just don't. So you got to have those other people around.
Yeah, absolutely. Maintain a sense of critical thought, think independently, don't be too influenced by the masses. And when you find somebody that thinks like that, try to surround yourself with them. It
Yeah.
emphasizes the importance of surrounding yourself with good people.
Yeah. Totally.
Ultimately, you become like those you surround yourself with.
Absolutely.
Yeah.
Absolutely.
So, a few more questions for you, Dr. Parker. First of which, you are somebody who has successfully blended medicine, entrepreneurship, and online education. So, what are some of the key qualities that you think are essential for success, both in these realms, but also in business in general and in medicine, particularly surgery?
Well, I think you got to believe in yourself. Everybody's busy with their own things and they don't really give a shit about you. And that's not their fault, but so you got to really believe in yourself. You got to bet on yourself and you have to work hard. And I think that's kind of it. And you got to be okay making mistakes. You're going to make mistakes as long as you try to recognize those mistakes and correct them to the best of your ability. I think that's about all because without believing in yourself and maybe a purpose, you need to have a purpose. I think that's important. Without believing in yourself and having a purpose, then you're going to go nowhere because nobody really is going to support you. And you're going to probably work hard and be the only one believing in yourself besides your mama for a really long time. And then at some point, people will catch on and they'll start rooting you on, but it will be some time before that happens. And that's just how it is. And that's okay. But I think people get very discouraged because they don't have support for a long time. And that's just how it is. Nobody really does. I mean, some people do have support right away, but it's not often, I don't think.
Yeah.
Exception to the rule.
Yeah, absolutely. So believing in yourself, betting on yourself from the get-go and working really hard, acknowledging your mistakes and working to correct them, and having a clear purpose and just operating on the understanding that it may be a long time before people begin to recognize what it is you're doing. Something interesting off of the believing in yourself topic, Ryan Holiday, the cool stoic guy,
Yeah.
Daily Stoic. I
Yeah.
read something interesting about believing in yourself, and he's like, you don't have to believe in yourself when you have evidence, right? Over time, as you develop
Yeah.
clear success, you can draw from that. And then that's just proof. I don't have to believe in myself because the proof is right here. So it's just a
That's
pretty cool
very
idea.
true. Yeah.
So as you stay consistent over that time when nobody gives a shit about what you're doing, you get those little nuggets and you're like, I can do this. You
Yeah.
get those little wins along the
Yeah,
way.
I mean, definitely wins are important. It's tough to just believe in yourself and not have any wins for a really long time. Sure. I definitely think momentum is really important. Purpose, momentum. Yeah, momentum is very, very important. So getting little wins, building them up, having bigger wins helps a lot with that confidence and believing in yourself.
Big time. So, Dr. Parker, the mission of the physician's mind is to give successful people a platform to share their experiences and their advice with curious people who want to optimize their journey of lifelong learning and self improvement in medicine and beyond. Do you have any advice as we part ways here that aligns with that mission?
I think we already said it. I think the big ones are just you have to believe in yourself, you have to work hard, you find people that are amazing, stick with them, be independent thinker, and find your purpose. Follow that. Make sure that you're following your purpose and your goals and not somebody else's. Those are all important.
Dr. Parker, thank you so much for your time today.
Yeah, thanks, Chris.